We are here for the veterans. We are not here against the ODVA or anything. We are here for the veterans. When our soldiers go off to war, we tell them, you take care of us and we will take care of you. We have committed to our veterans that they will receive the highest level of care. The highest level of care in Oklahoma is the 7 veteran centers and the medical amenities they provide. These amenities include physical therapy, pharmacies, EKGs to monitor heart medications, and blood chemistry labs to monitor their kidney function and other organ functions. The kidney function tests are important to gauge what type of IV fluids are to be administered, and it is imperative that they get the results in 1 to 2 hours. Now comes the ODVA directives that the EKG machines are to be locked up and taken away of the blood chemistry machines. There is a move to decrease the level of care of our veterans and move our veteran centers to the level of care of a nursing home. But why? In 2015, when General Deering and Deputy Director Elliott took over the ODVA, the software CPRS was going out of date, and they had to face the task of spending a large sum of money to update it. CPRS is the same program that the federal VA uses and can communicate with the federal VA. At the same time, they hired Tina Williams, an RN, to be in charge of the health care day-to-day functions of the centers. She previously had a record of running nursing homes and making questionable decisions. She'd also worked for the state health department. She directed Deering and Elliott, who had no health care experience, to a software program, Point Click Care. With Deering and Elliott not having any knowledge of health care, they chose Point Click Care. Unfortunately, Point Click Care is a software designed for nursing homes. It does not have the codes for the medical amenities that veteran centers provide at a higher level of care. So the answer to our question seems to be that they chose the wrong software, as they are determined to lower the standards of care at our veteran centers down to a nursing home status. What deleterious effects are there towards moving to a nursing home status? First, dementia veterans are adversely affected by any move, even a trip to the ER or other medical provider for an EKG or other test. When treating dehydration health-wise, it is unfeasible to draw blood and send it to a private lab and get the results back 24 hours a day or 24 hours later, when an in-house test that will give you the kidney function test within an hour. This is lowering the level of care of our veterans. We do not believe that Director Deering and Deputy Director Elliott intentionally mean to decrease the level of care of our veterans. They just put their health care trust in the wrong person. We are therefore asking the Attorney General to launch an investigation by his office of the ODVA and request the state auditor to perform an emergency audit of the ODVA. In addition, we are requesting that the ODVA return the EKG machines to the healthcare providers at the veteran centers, allow blood chemistry machines to remain in place, and freeze any terminations of healthcare providers at our veteran centers until the investigations are complete. We believe that there is an appearance that the bill to close the Tallahena Veteran Center was a smokescreen for reducing all these other medical amenities at the other 6 veteran centers. If the ODVA says that the reduction of these services is to save money, ask them how come Deering, Elliott, and Williams received a combined total of $25,000 in raises in the last 6 months, with the legislature cutting $6.7 million from that agency in the last 24 months, and now we're facing a $1 billion deficit. I have an open records request that confirms all of these salaries that I'll be handing out to you all. And we also have directives to substantiate these reductions in clinical services for these veterans, which reduce the level of care. It's all about the level of care we're concerned about. If it went back up tomorrow, we would be there. But we do feel like there's a lot of people don't think you ought to question a general. We feel like you ought to question everybody except God, to make sure these veterans have the level of care that they have been promised.
The stated issue at that time was staffing problems, that they could not find adequate staff to staff the Veterans Center. As I began to look into into this problem, I found there are other problems in the veteran home system. I really want to address the Talihina Veteran Center problem and the relocation for the reason of staffing. Even if approval for a relocation of the Talihina Veteran Center would take place from the national VA system, it would still be 3 to 5 years before the veterans would be relocated in a new center. During that time, the veterans still have to live in the Talihina Veterans Home. And the problem still remains, staffing. How are you going to take care of the veterans that are still there during this time before the relocation takes place? I've asked this question from January till now, from General Deering and his staff. I wanted a plan. How are you going to take care of the veterans that are there at the Talihina Veterans Center while the relocation project is being carried on? I have yet to get a satisfactory answer or any answer from that question. If you resolve the staffing issue for those 3 to 5 years at the Talihina Veterans Center, then you can resolve the staffing problem at the Talihina Veterans Center from now on. And so why is it necessary then to relocate the Veterans Center from Talihina to somewhere else? And why is it necessary to spend $80 to $90 million to do so?
I'm here today because I was a member of the A&B Health Committee and chairman of the Public Health Committee, that I had questions that weren't answered up until the time that we were thrown into a situation of a bill to vote to close the Talihina Center. After visiting with many of the people, the individuals and veterans from the Talihina Center, Veteran Center, I felt like that there was some concerns, no blame that I felt like at that point in time on anyone, other than previously mentioned some staffing problems. But I thought it'd be important and prudent, as I have ordered interim studies in the past, and to slow down the process, get the facts, help our fellow veterans, and make sure that since they weren't any particular complaints, that we didn't do a knee-jerk reaction and close a center that was vitally important to the area as well as to the state and the veterans in hand. I would like to do this as a constructive type of situation and also a cost-effective, because there's a lot of interest in saving money in the state recently with the budgetary crisis, and today we're now told that we're down even further with the release of another revenue failure with the OMS reporting them in email and press release. So that's my concern today, and we're not here to place blame on any particular individuals. I've tried to research this with some of my experts that are in the area, the chief of the Choctaw Nation Medical Corps there that's about a mile away from the Veterans Center. He did not see any problems with the care per se other than the staffing problems as previously mentioned.
I'm here today really to stand for the veterans. And first and foremost, let me say, for the 11 years I've been here, the Veterans and Military Affairs Committee has always stepped up on veterans issues. That's one thing I'm very proud of. Regardless of party, that had no effect whatsoever. The Veterans and Military Affairs Committee stood for the veterans. Well, here's a time when we have to say we need to stand again. These are veterans, for the most part, who are nearing the end of their life. And we want to make sure that we can provide them the medical care necessary to extend that as long as we can and to have the quality of life as good as it can possibly be. You know, just 5 months ago, I was reading a news report from News Channel 4, an interview about our veteran centers, the 7 centers. They talked about how great they were and how they were fulfilling the commitment to the veterans. They said that they were provided physicians, labs, radiologists, and pharmacies. Our concern is that those are being curtailed. My concern is that we're going from a long-term daily health facility to a nursing center. And I'm not saying anything's wrong with nursing centers, but what I'm saying is this is not the commitment that we've made to our veterans, and we need to fulfill those commitments. Thank you.